So today we're going to be talking to you about pneumonia. Pneumonia is the inflammation of one or both lungs where the alveoli become filled with liquid, which renders them useless for breathing. This can be caused by viral or bacterial infections. An invasion of an organism pulls a response from the lung's overly responsive immune system. This can cause small blood vessels in the lungs to spring leaks. As the protein-rich fluid oozes into the alveoli and fills the lungs, there's less room for oxygen and carbon dioxide exchange. In addition, mucus starts to form rapidly, and these mucus plugs can get in the way of gas exchange in the lungs. This further reduces the area available in the lungs to breathe in and out.
So some signs of pneumonia may be fever, sweating, and shaking chills, lower than normal body temperature in people older than 65 and in people with overall health or weakened immune systems. You may experience cough, which produces phlegm, a thick sticky fluid, vomiting, or diarrhea. And on the symptom side of pneumonia, you may experience chest pain when breathing deeply or coughing. You may experience shortness of breath, fatigue and muscle aches, nausea, excessive sweating and clammy skin, headaches, loss of appetite, and low energy.
So if a person thinks they have pneumonia, obviously they're going to go to the doctor. And the first thing the doctor will do to see if they need to diagnose them or not is to listen to their lungs with the stethoscope. And if they hear abnormal bubbling or crackling noises, then that is a sign that they could have pneumonia. So then there's some other things that they could do to see if it is pneumonia or not. And one is a chest x-ray. The x-ray will show the doctor where the pneumonia is and how intense it is. They could also test the patient's blood, which will identify the type of organism or pathogen that may be in their blood. And this only works for about half of the people that are infected with pneumonia, so this isn't the best thing to do. They can also do a pulse oximetry test, which measures the O2 levels in their blood, and pneumonia obviously lowers oxygen levels because it's blocking airways and everything. And the doctor can also try a sputum test, which is where the doctor takes a sample of fluid from their lungs and then analyzes it to see what kind of infection it is. But if the patient is over 65 years old, the doctor can also do a pleural fluid culture, which is where the doctor takes a sample from the pleural area and does the same thing as the sputum test. They just try to identify what the infection is. And they can also do a bronchoscopy, which is where they send a camera down the person's throat into their airways to see if there's a blockage in the airways or something else is causing the pneumonia.
Alright, so treatment depends on the type of pneumonia that the person has. So for viral pneumonia, antiviral medication would be given to the patient, and then generally after 1 to 3 weeks, the patient would start to feel better. For bacterial pneumonia, patients are generally given antibiotics, and depending on whether the patient has a pre-existing condition or has a severe case of pneumonia, they would be giving either a heavier dose or a more potent medication. And then patients in general should follow a proper diet, and if necessary, they may be given more oxygen to increase the level of oxygen in the blood. No matter the type of pneumonia, patients with pneumonia can use any of the following to help speed up the recovery time. So it's advised that they drink lots of liquid to help loosen up secretions and bring up the phlegm. Patients are also asked to get lots of rest, and before taking any cough medication, they should consult their doctor, as it may cause expelling the sputum to be more difficult. And any symptoms of fever can be relieved with an aspirin or any other kind of non-steroidal anti-inflammatory drugs. And then for patients experiencing severe pneumonia, the hospital may administer fluids and antibiotics in the veins, as well as provide oxygen therapy or other breathing treatments. But pneumonia is something that can be prevented, and these are some means of prevention. So they can get a seasonal flu shot, they can get a pneumonia vaccination, they should practice good hygiene, they shouldn't smoke, and they should stay rested and fit.